So firstly, I've just got a picture up here to show you guys the difference between the male and the female cat urinary system. So as you can see, the ureters here, so the ureters connect the kidneys to the bladder, and then the urethra here, this is what takes the urine out of the bladder. So this is where we get our blockage here. It's going to be in the urethra. So as you can see with our male, they really have a much more narrow urethra and a big bend right here. And this is why male cats are more prone to becoming blocked. Whereas our female cats are generally it's quite smooth. The urethra is quite a good size, so they can urinate relatively easily as well. So the urinary system is really important, as we know, as our kidneys are as well. So it removes waste, it maintains the appropriate balance of water and electrolytes needed amongst the body. So thinking about that, we can start to think about why this condition can be so detrimental to the patient's health if it's not treated rapidly. So what exactly is feline lower urinary tract disease? So we have to think about the fact that it's not a specific condition, but more of a term to describe a condition. So there's many different things that can cause this as well. And the feline lower urinary tract disease can also be idiopathic, so it can be an unknown cause, and it can be obstructive, which would be fatal without treatment, or it can be non-obstructive as well. So can any of you guys just write in the chat box any potential causes that you know that can cause a urethral obstruction in our male kitty cats? Maybe you've come across this in your hospital before, or maybe your own cat has become blocked as well. Yeah, sediment, exactly. Yeah, so stress can absolutely cause a blockage. So that's very, very accurate. Yeah. So there's many reasons that we can, and we need to think about inflammation is really important as well. Cat food could absolutely have a play. Stones and plugs is really important. Yep, like you can see on the screen there. Yep, awesome. So all these things. So we'll talk about the causes specifically. So uroliths. So uroliths is specifically stones. Generally can cause this in 10 to 15% of cases. So you have your struvite, which are pictured on the left here. And then you have your calcium oxalate, which are pictured on the right. And what these stones do is they move from the bladder and they get lodged in the urethra. And as you can imagine, that's incredibly painful for our patients. Bacterial infections, slightly rarer, but definitely can cause an obstruction. Urethral plug, like one of you mentioned. Urethral stricture and neoplasia. So stricture and neoplasia generally I find is not commonly a cause for our cat friends. Neoplasia can absolutely be for dogs, and I definitely have come across dogs that do unfortunately have a neoplasia, a tumor growth in that area that has caused an incredibly painful urethral obstruction, because obviously this is incredibly painful, which we will discuss as well. And the biggest cause of urethral obstruction is idiopathic cystitis. So idiopathic meaning we don't know the cause or the reason why they've got cystitis, but like some of you have mentioned, it's often occurred secondary to stress, and they can have a urethral spasm as well, which is what can cause this cystitis, which is incredibly uncomfortable for our patients. So how can this obstruction occur? So if you guys just want to pop in the chat box, one of you already mentioned diet, which was absolutely correct. What are other ways that we can predispose these male cats to becoming blocked? Or what's advice that we can give to our clients to try and prevent this from happening? Yes, lack of hydration is really important. Obviously, if your cat regularly spends time outside, you don't know how much water they're getting, and it can be really hard to keep a track of that. And obviously, our cats can be really difficult when they're trying to drink water as well. Some of them just don't always go to the water unless it's a beautiful fountain or something along those lines. Dry food diets, absolutely. Lots of cats, lots of stress, less cat litter boxes, 100%. That's definitely something that could put them off. Obesity, really important. And you can even see that on this kitty cat here. This guy was a whopping 7 kilos. He was a big boy, but yeah, you guys are all over it, which is amazing. So diet, as we mentioned, specifically a dry diet. However, my cat is on a dry diet, so I'm not saying don't feed dried food. I guess just be aware. Reduced access to water is really important. Being a boy, as we've already discussed, they've got that narrow urethra with a big bend in it, which is incredibly, predisposed to catching any debris that could catch there. Indoor versus outdoor. So, they might be going outside and urinating, or they might not be urinating. And that is an issue because the owners might not notice the condition until these patients are peri-arrest or they have rapidly decompensated. And that's when they do arrive at the hospital in a really bad bad way, and we have to act very quickly to save these patients. Inactive lifestyle, obviously not many of us walk our cats, but certainly, as you can see with this big boy, I don't think he gets too much exercise. And stress is massive. So when we're speaking to clients on the phone and we're speaking about, they called us up, they said their cat's not behaving quite normally, you could definitely question a few things, such as, have you recently changed? Have you had a baby? Have you had a puppy join the family? Is there building work next door? So this is obviously really helpful for us as well. Yeah, really good point. Someone's just mentioned we see more in winter, which is appropriate because obviously we are going into winter, and especially me coming from the UK, we had an influx of these in the winter because it's just too cold, and cats in the UK regularly do go outside as well. So these cats, these big fat cats, are too lazy, they don't go outside to urinate, and then they do unfortunately become blocked, which can be obviously really dangerous. All right, I want you guys to get involved again. So clinical signs. So let's think about, you know, if we were on the phone to a client and they were discussing some clinical signs, and obviously these are so incredibly varied, and no one specific sign can indicate a blockage. Yeah, turgid bladder, yep, recumbency, so yeah, not wanting to get around, howling mainly in pain, straining to urinate. Yeah, this is an incredibly painful condition for these guys to have. Yeah, definitely, 100%. Like you can see in the picture here, in and out of the litter box. Yeah, hypersalivation is a really good one because that can be due to pain and discomfort as well. Yeah, looking bloated, because not all clients will kind of know how to feel where the bladder is. So yeah, that's really important as well. Inappetence is very important. And that's the thing we need to consider, is these guys will present to the hospital not only in pain, not only potentially be blocked, but also could have spent 2 or 3 days not having any food or nutrition. So they've also got dehydration and maybe even hypovolemia on top of their blocked bladder. Aggression is important as well, 100%. Yeah, amazing. Well done, guys. So I think we've covered them all, but I'll just quickly go through the ones that I've got, just in case there are any different ones. So we've got vocalizing, like you said, so dysuria, so difficulty urinating. Stranguria, straining to urinate. Polyuria, so that's increased frequency of urination. So basically the irritation increases the desire to urinate. So these patients are going to be going in and out of the litter tray, and that term is known as polyuria. Hematuria, I've just seen someone mentioned, absolutely, they could have blood in their urine, which is always a bit scary, hiding under the bed due to feeling terribly unwell. Vomiting and anorexia, as I said, these patients might present with not one concern, but 2 concerns, which is obviously dehydration, and then completely separate is hypovolemia. So hypovolemia and dehydration are very, very different. So if we think about dehydration, it's general dehydration of the body. So signs include skin tenting, dry mucous membranes, lethargy, whereas hypovolemia is loss of fluid within the intravascular system. So that can definitely occur if they've had vomiting or they've had other severe losses of fluid. So that can be very difficult and you need to act very quickly to treat that as well. Lethargy, stresses at home, over grooming, and like we've said again, obesity and just being male. So yeah, well done, everyone.